welcome everybody. Thank you for joining, for tuning in to this podcast today. I am excited to be joined by a good friend of mine, Dan Weberg, and we're going to be talking about AI. So for us, AI is a buzzword that we hear multiple times a day, but realize that that might not be the case for everyone. And you're starting to hear it a little bit more. You might start hearing about how it's coming into your world and how the health systems you're working for might be thinking about this stuff. And there might be some concerns about how it could influence your job. So we're here and joining Nurse.org to give you some of our insights and perspectives. And so we look forward to the conversation. What we thought we'd do is just start by letting you know a little bit about who we are. So Dan, how about I hand it off to you? Tell them kind of your story and how you got here.
Yeah, no, I'm excited to talk about this. I mean, almost every single thing you see on social media, on the internet right now says AI. And I think we got to cut through the buzz of all that. So I'm Dan Weberg, also known as Dr. Nurse Dan on LinkedIn. I'm an ER and trauma nurse and have done really focused on innovation. My career has been on the cutting edge of technology. I was the first guy on my unit to bring in the Palm Pilot 3 and start using Hippocrates and look up drugs, but when everyone else is opening, the 500-page drug book, that was me. And then try and teach all the nurses, like, hey, you got to get this Palm Pilot 3. It makes life so much better. And just throughout my career, I've been doing that and did my master's and PhD in innovation. And how do you lead change in systems? Because I truly believe this is nursing's blockbuster moment. And I mean that in blockbuster video. We have the chance to double down on the past and use sort of our old techniques that we learned in nursing school, or we can adopt the future, the technology, the systems to make our lives easier as nurses, because there's a shortage. And I truly believe if we adopt these technologies, we're going to be able to enhance our profession, become more competent, confident, and impactful nurses. And we have to do that by understanding the technology that's emerging and be up to date on what that is, and not just blindly reject it, but learn about it and see how do we incorporate that into our practice. So today, I think that's what we're going to talk about. Awesome. So Rich, what's your story?
Yeah. So we're kindred spirits in the sense of kind of trauma, ER background. Started in the ICU, then moved into the ER, and then was a flight nurse for a number of years. And so same kind of thing as far as that drive or that penchant for use of technology, right? So same thing, like had that Palm Pilot, had that, I was started flying around the time we started having the smartphones come to play. So, carrying one of those around, how do I get all my protocols? How do I get all these things onto my device? And so I can utilize those, reference those. Have always kind of been on that forefront of how do we incorporate technology to make me a better nurse, better clinician. So I think that's one thing we can get into maybe a little bit later as far as how AI can help us retrieve information better, some of that kind of stuff. Yeah. But, I practiced as a nurse for a number of years, and really for me, it was recognizing the impact that technology was having on how we deliver care and the experience, not only for the patients, but for us as nurses, as clinicians. And as a flight nurse, it would take two of us an hour to document a 15-minute flight. And nobody looks at that stuff anyway, right?
They just want the report when you land and get out of my way.
Right.
We got it, right?
Exactly. And so starting to think through how do we utilize technology to enhance that experience? Because I recognized I was starting to get burnt out. I was seeing that in my colleagues. And the way that we have been deploying technology in healthcare hasn't been all that great. So that's what gives me so much excitement about AI. I've just joined Veritas Labs as a chief clinical officer. We're an AI company. We're developing AI agents to deploy in healthcare. And it excites me because I think this, to your point around this blockbuster moment, for me, seeing AI, I think, is the first technology that we're seeing that will allow us to get back to kind of the essence of nursing, providing care to where, if we design this right, we've got technology working for us versus it being kind of this barrier and us having to kind of work towards the technology. I think of that best picture of healthcare, when I kind of think of what I want healthcare, that experience to look like, is where really you don't even see any technology. It kind of disappears.
It's in our workflow, right?
Exactly. Yeah. So we've got our listeners are nurses, obviously, a lot of younger nurses, nursing students. So why don't you start with telling some of the use cases that you're seeing with AI, and then maybe what we can do is unpack what these words mean when we're saying generative AI or machine learning or some of those things, to start giving people some of that foundational knowledge.
Yeah, I mean, I think that's a critical question, right? What is AI and what isn't it? So I think we'll unpack that today. I mean, everything is considered AI. You know, the algorithms we've been using for decades, like the Muse score, I've been heard called an AI tool. And it's not. It's an algorithm. It's a calculation. Or the latest big data. Oh, that's just AI. And I think nurses really struggle with that. In fact, there's been a couple reports of nurses protesting outside of hospitals because they think that what they've been told AI is going to start taking jobs and that kind of stuff. And I think we really got to create clarity around that. But I think there's a couple places where AI it can be used and is being used now. So I work for a very large health system, and we're using machine learning tools, which is a little bit different than AI, to calculate risk scores for sepsis. And we've been doing that, validated, researched, accurate, can predict sepsis hours before a nurse or a physician would see the changes in vital signs. And I think that's really the promise, right, from a clinical perspective. Nurses have intuition. We've never been able to sort of measure what intuition is, but we know it exists. I think there's tools within AI that can take data sets that we could never as a human understand or uncover or find in a medical record and start giving us insights and validating that intuition so we can make better clinical decisions. I think the problem with that is nowhere in nursing school are we taught how to take machine generated insights and turn it into clinical decision making. And so I think there's fear of, well, do we blindly trust the machine when our entire profession has been told, touch the patient, look at the patient. And now we're being told, well, there's things that are more accurate than us looking at the patient. How do you justify that? I mean, I think that's a critical question. I think on the efficiency side, you think about staffing. You walk into your unit, you got assigned to Tuesdays your shift, and then you walk on the unit and they're like, hey, you got room 567. But there's no matching, right? It's like you're gonna see these patients, but you as a nurse, you have individual skills, competencies, passions, career goals. What if you could document that and through a machine system, an AI system, match your professional skills and professional goals to match you with the patient needs? And now we've intimately matched patient care and nurse competency together. We could have potentially better outcomes. And I think the last piece is in the system. There's a lot of inefficiency. There's a study done in 2009 around time and motion study of what do nurses do during their day. And you can imagine 50% of it basically is charting, but a big chunk, 36% of that, of a nurse's time is hunting and gathering information, finding people and finding stuff like pumps and devices and tools. AI can take all that off our plates. Instead of running around trying to find where the pump is, you can use tools to locate those things with real-time data. You can find people and ask questions of bots and agents to ask natural language questions instead of trying to page the physician for the things. We can really enhance our workflow so that we can get back to patient care and out of the computer screen. I think that those are the promises that we have with AI.
So that's, so it's looking at probably 80% of what a nurse's job looks like today. And non-value add, right? You said earlier, there are those risks and those concerns that people have, and not just in nursing, but in multiple different, professions about how AI is going to take away their jobs, right? We've had Screenwriters Guild protesting. We've had some nurses protest. Right now, just a few days ago, we started with the dock workers that are protesting against automation. And so, again, I think the hope is to look at, well, what are those non-value add tasks that have creeped into our roles, and how can we automate those? And so I think there's a lot of the discussion around that needs to be had, and making sure that nurses are at the table for this. And not just asking, should we, but or not just asking, could we, but should we? I guess, right? and trying to figure out what are those non-value add tasks that we can automate so that we can put the human where we really want the human.
Right.
You raised a kind of a good example around, how do we start to understand intuition, right? And we always got that nurses, that gut feeling that
trust your gut.
Yeah, trust your gut, right. I always like to tell the story of when I was orienting as a new ER nurse. I was sitting out at the triage desk, and I was with this...
Scared to death, right?
Right, yeah, exactly. But I was sitting with this senior nurse, thankfully, and I'll never forget, this was in East Tennessee, and we had this gentleman walk in, and just as he crested the door, she was able to pick up, and I still, to this day, I don't know what she saw. But it was with how he was holding himself. And when she started to kind of ask him about his pain, it was just kind of some shoulder pain.
Yeah.
But before she got there, she had this intuition, this gut feeling about like, that guy's having a heart attack.
Yeah.
And jumped up, ran, grabbed a wheelchair, all that, right? Started all that. And she was right. And so when we think about the use of AI, and maybe we can start unpacking this term a little bit, but when we think about deploying computer vision and some of those types of technologies, there's something there she saw, and her brain was able to do the calculations and make those predictions and identify that.
Yeah.
I feel like there's going to be a time where we can probably replicate that through some of the computer vision machine learning.
Yeah.
And so if we can help nurses in that way so that the nurse can then intervene, I think, to your point, we start to see this healthy synergy of kind of human and computer.
Yeah. So we've said AI now about 5,000 times.
Yeah.
So we better define it.
If this were a drinking game.
Yeah, we'd be 6 shots deep by this time. So
if you're listening to this, don't
play the drinking game on how many times to say AI.
Yeah.
But I mean, you worked at a large technology company, indirectly in AI.
Yeah.
Can you define AI and maybe like a couple terms? What is AI? What is machine learning?
Yeah.
And then what is just algorithms? And like, what are the differences, just so our audience can know what that is?
Yeah. So we talk about this term AI, and at its most simplistic form, it is just any time that we take a computer and we replicate a human task or some kind of human function. Now, that's obviously a pretty broad definition.
Yeah.
So today, where we're moving more towards is specifically around simulating human intelligence. So that's things like learning and reasoning and like self-correction, some of those types of more higher level human intelligence. And the machines have gotten really good at doing some of that. So with that, if we kind of take a little bit more of a higher, more advanced definition of AI, then we can break that down into 3 types of AI. So you've heard us also say machine learning. So we'll say machine learning, natural language processing, and then computer vision are kind of the 3 types I like to, again, just to simplify.
Yeah, broad brush.
So machine learning, what we're doing, so if you think about how we learn as humans, right? We'll study, we take in a lot of data, and we try to memorize that. We try to make, and particularly how young children learn, they start to draw correlations between things that they might have learned already. And so you're looking for patterns in the data, and that's what machine learning is. So whereas before, what we're doing is we would have data and we would kind of identify the patterns, and we would try to define exactly what we want something to do manually. Yeah. Now what we're doing is we're taking the data, we're throwing it at this algorithm, and we're giving it reign to figure out its own rules. So we mentioned there is, when we talk about algorithms, is another word we use frequently in this world, right? So there are the more rules-based decision-making or algorithms where we define those rules.
Yeah.
What we're moving more towards now is where we've got the machines that are able to kind of define their own rules. And so we throw a bunch of data, we say, we tell it to find patterns in the data. And that's machine learning.
Yes.
That's essentially what we're doing there. Natural language processing, what we're doing is we're taking human language and we're having it kind of read and try to codify the human language. And
like conversation, right? Conversation.
Yeah.
Talk to it like you're talking to a friend.
Exactly.
And it will respond in the same way.
Exactly.
Yep.
Yeah. So where we're starting to lift, and really in the field of medicine, we started doing that with reports, right? Like take radiology reports. Where we would do that, and we would do the natural language processing to where we could then lift off. Okay, here's the diagnosis. Here's the some of the other findings and such. And so we're using NLP to do that piece. So then computer vision being that third type. So if everything we've talked about so far, it's all about data, about ones and zeros and text type data. Computer vision, if we think about the text and machine learning as identifying patterns in the data, what computer vision is doing is identifying patterns in the pixels. So we're looking at correlations. When I typically see these pixels arranged in this way, that
means this.
Exactly.
Yeah. And so like Google image search, right? You can take a picture of something and it pulls up in products or images or search that's very similar to what you've taken a picture of.
Exactly.
Yeah.
So making those predictions then, at the core, it's basic statistics.
Yeah.
So we're doing that. Now, what I think is also got
I failed statistics class. So
I worked for a statistics company, analytics statistical company, and statistics was my worst class as well. So it was always like the jokes on me. So I ended up going and working for the statistics.
But I think that's a good point, though. Like you don't have to be an expert in computers or data science or any of this in order to generally understand AI or even utilize it.
Yeah.
So I think that's a typical barrier. Like, well, I don't know how to, turn on my phone and, use that. How am I going to use AI?
Yeah.
I think the benefit of something like AI, natural language processing, is you can talk to it like your buddy at the nurse's station.
Yeah.
You can be like, how would Sally RN with XYZ experience answer this clinical question from you? There's people that are using just AI tools out in Google and Meta and all the ones out there and asking those questions. You can get a pretty interesting response that's generally correct. Yeah. So I think the barrier to entry to utilizing things is really low now, because before you had to understand statistics, you had to be able to move a pivot table and work in Excel and all these different tools that you're like, I don't even know where to open the app for this thing. Yeah. And now you can open up a web page and say, hey buddy, tell me, the top 5 restaurants, and rate them based on, Anthony Bourdain's opinion, and it'll pull it up for you. You just ask it like you're asking a friend.
Yeah. So I'd say that's what's really changed in the last 2 years is with this availability of what we call generative AI. So, if we can all kind of agree on that simplistic framework of what AI is, we're kind of replicating human tasks. There's generally 3 ways that we're trying to do that through machine learning, natural language processing, and computer vision. What's come about over these last 2 years is the availability through tools like ChatGPT, Google's Gemini, Facebook's Llama, all these companies. We've got Perplexity. I could go. We could sit here and rattle off all the companies. Right, exactly. All these different companies that are developing these large language models. So that's what you're referencing. So let's talk about what a large language model is. So when we talk about AI and we talk about this generative AI, if we think about this machine learning as really trying to recognize patterns in real world data, what generative AI is doing that, but then trying to generate new data that looks similar to that. So so a large language model is essentially, the way to think about that is just a very large machine learning model where we're throwing. If before we were taking kind of a curated data set, what we've done is now we've taken
the internet basically.
Exactly, just thrown the whole internet at it and said, here, go train on this. And it takes millions of dollars to train one of these large language models. But the patterns that we wanted it to try to start recognizing are things around syntax and grammar and those types of things to understand how we communicate as humans. So because it's gotten really good at that, though, it's very easy we have to remember that all it's doing is making predictions to try to replicate those patterns in the syntax or the grammar. So when we give it a prompt, when we ask a question of it, all it's doing is looking at the text in that prompt, breaking it down into what they call tokens, but basically words, and looking at everything else that's known and trying to predict, okay, well, what's the next word?
Got it.
And then going back and say, okay, well, I've got this pattern. All right, well, what do I predict as the next word?
Yeah.
Which means that's all it's doing. It's not going back and retrieving facts. It's just gotten really good at predicting the next word, and that so happens to kind of correlate with what we know, kind of in the world of knowledge and evidence.
But when you think about that from a nursing process perspective, like I think about myself in the ICU or the ER, that's what I was doing, right? I was taking in data that I was seeing and then trying to predict the next thing, right? To the best of my ability. You come in with a chief complaint, you have these vital signs, you have this thing, this history. In my head, I'm already jumping, okay, here's the 5 things it could be. I'm going to make a guess on the top 2. I'm going to test those out and start knocking those things down. And then I'm going to get some more data and I'm going to make another guess. So in essence, it's replicating sort of that nursing process, and it could enhance it, I think, too. There's a tool, as we talk about sort of, so what it does this stuff, right? You can ask all these questions. I think about like triage, because we're both ER nurses, and you triage, you're guessing, like you're getting very little information and you're trying to predict what the next thing's going to be and then rate it in a risk score. And there's tools out there now that can enhance that, not replace nursing, because I think that intuition means something, your experience, you have more context and ability to make connections to patterns than the computer does at this time. But what if it was enhanced? What if you missed something? What if it could look back in a history 10 years ago that you don't have time in the triage desk to look back at? It can pull up these data, make correlations with historical data related to that and say, hey, I know you think this guy's an ESI 3 because he has shoulder pain, but based on his history and other people like him in the same town with the same history, he's actually having an MI. And so there's a 40% likelihood that he could be having an MI. I suggest that you consider making him a 2 and bringing him back real quick or doing a 12 lead.
Yeah.
And that's enhancing clinical decision making. I think a lot of people are jumping to, this is going to replace nursing. It's to replace my clinical decision making. We're going to hire the lowest paid person to do all these tasks now because the machine's going to do it. But I see it as a superpower. I think this is our this is a cape we can wear. If I could be 50% more accurate in my triage, imagine the lives that I can impact, right? Imagine the resources I could be more conscious about, the staffing models and the people and the right care I could deliver to that person instead of sort of best guessing that stuff. And I think that's really the promise of all of these tools. And, as you described it, I was just thinking that this is an enhancement of the nursing process. And if we think of it like that, we can almost do anything. Yeah.
Well, and it starts to help us. It puts us in a position where we need to start rethinking what this tool, I guess this skill around critical thinking is too, right? Like, what does that look like for nursing?
Yeah.
And what are those things where we used to spend all that time around information retrieval? Yeah. And where we can where we're actually spending our time trying to synthesize this information and bring that into practice. So I think in those ways that those kind of technologies can really help with that. I guess so. With when we talk about this generative AI, right? So we've talked about here's what AI is. So you've kind of introduced some terms, some technical terms around machine learning, natural language processing, computer vision. I think the other important distinction to make too is this what we define as narrow AI versus general AI. Yeah. So one thing to remember is that with all these things, we also have to give it a goal. Like, so in the context of generative AI, like its sole purpose in life is to produce a response.
Right.
So understanding some of its limitations, I think, is also going to be really critical for us as nurses. Yeah. As any in any vocation utilizing these technologies, understanding what the limitations are. So in terms of the generative AI, right, its goal is to produce a response, whether it's correct or not.
Right. It's not fact checking itself. Right. Like it's giving references, even those are sometimes off the wall.
Yeah. When these things first hit, when they first released these, we're going on almost its 2-year anniversary now. It was the technical term for this is called hallucinating or hallucination, right? I jokingly say like it's a BS machine.
Yeah.
But if you think about that, like if you say cite references, its sole purpose is to give you a response, so it'll make up a reference.
Right,
whether
and it's done that. I've seen it do that. Yeah. It's had the right author, the wrong title, and the wrong publisher. Yeah. Right, in an APA format, we played with this. We had actually one of the publishers I work with for a journal. We tested it. We had it write a 5-page paper on, I forget what the topic was, some clinical topic, and we said generate the references, put in text citation, wrote a perfect outline, abstract, perfect outline for a journal article, and then the references were completely made up. Mm-hmm. And so you can't just blindly trust this thing.
Yeah. So when we talk about the limitations, so let's talk about those for a little bit. What we're touching on is what we call an automation bias, because it can present itself because its goal, and it's gotten really good at producing a response. It's easy to just accept that as fact or as truth and move on about our day. So these are maybe some of the things that as nurses we need to be aware of in how we utilize, and we don't just blindly accept these things. Because like you said, you created this brilliant paper. Right. How easy would it be? Oh. And I've even seen these papers make it through publishing.
Totally, yeah.
And, when we look at other professions, we've had lawyers who have written complete legal briefings citing prior cases that never existed. And so there are implications for this if we're not being wise users of these technologies.
So I think there's a couple of things. I wrote these down, and I'm fully aware I'm using paper in a discussion about AI. So that might be part of the drinking game. But so there's a great slide that I actually you inspire me, because Rich does some great keynotes around AI and the future of nursing, and I talk about the future of nursing, our blockbuster moment. How do we lead the change in our healthcare system? And together, there's 4 things that I sort of pulled from some of your content and some of the content out there around the downsides that I've heard people say about AI. Right. Mm-hmm. So the first one is it's biased in its decision making, right? It only knows what it's been trained on. And, if you look at the history of medical research, there's a lot of bias in that. It's been done on mostly, Caucasian male patients, minority data isn't in there. Women data, other countries isn't in there. So it only knows what it's been told. I think the second thing is a privacy. Well, if I put it in there, now is it part of the internet and everyone can access my information? I think the third one is lack of transparency. So like we talked about, it doesn't always reference where it got this information. So is it a trusted source or not? And it's hard to verify that. I think the last piece you talked about was hallucinations. I mean, my thought on all of those, and I think of this from a nursing perspective, before we had computers, we were all charting on our papers, which I know nurses love their charts. You would go ask, Sally, the nurse has been on the unit for 20 years. What do I do in this situation? Well, Sally could do all of those things too. Sally could hallucinate. Sally has privacy concerns, right? Sally could go and be like, what kind of stupid new grad question is this? We're not going to talk, why are they even asking? Why are they even employed here? They have a lack of transparency. We have no idea how Sally knows that. And she's not referencing or citing things necessarily, right? It says, I've been here for 20 years. And then biased decision making. Well, Sally's only worked in this unit for the past 20 years. She only knows what's gone through this unit. She doesn't have knowledge necessarily outside of that. And so I think people have the same biases as AI, but yet we trust Sally a little bit more for some reason, because that's just how humans are. So I think we have to sort of, as clinicians, start thinking about the evidence-based practice process. And, one of my mentors is Dr. Vern Melnick, who literally wrote the book on evidence-based practice. And we have to see AI-generated insights or machine-generated insights as another source of evidence and appraise it the same way we would any other source of evidence. So not that you have to make an evidence table of all your AI responses, but you have to start thinking about and challenging, does this sound right? Based on my clinical expertise, does this sound right? Based on what I see in front of me, is this directionally correct? And if we just blindly trust the machine, we're going to start hurting people. But if we think of it as another source of evidence that can spark another idea or another prediction or another, idea of what might happen, then it's safer, because we're running it through our clinical decision-making engine that we learn as clinicians, and we can add that layer of safety on top of it. I think where we could get into trouble is if we don't do that. Now we're trusting a machine that we can't even reference, and I think we could potentially create patient harm that way.
Yeah. I think the transparency, and that's a good point. I haven't thought about it in terms of like, we don't know how that, that experienced nurse, like we don't have really transparency into his or her decision making.
Right.
I haven't really thought about it in terms of that comparison, but you're absolutely right. We in the technical world, I guess, we're looking at this from a responsible AI perspective, and transparency is one of the key and core tenets. Because with the generative AI, if you think about what it's learned to do is predict that next word, and it just keeps making those predictions. We don't know how or why, but then there's some randomization as far as which one it actually chooses.
Yeah.
It doesn't always just choose the top, the one with the highest prediction value.
Yeah.
So, why did it choose this word versus that word?
We have no idea.
We have no idea.
You're right.
And so, that's what kind of gives us pause for, okay, well, now we're going to start basing decisions potentially that will affect people's lives on this stuff. And we want to be transparent about that, right? If, and probably not a matter of if, but when there is harm, how do we trace that back? Right? How do we dissect
that? Who's responsible for it? And it's going to be the licensed nurse. I mean, at the end of the day, you're responsible for the decisions you make for your patient care.
And that is how the regulations right now are written. Right? So that's why I think it's incumbent on all of us as a profession to be aware of this stuff and not blindly accept it. And know that you're going to succumb to this automation bias, but start to think about how you push back and how you fight against that.
Right.
Because it is you and your license that are ultimately on the line for that right now.
And I think, one of the things that is, I think, timeless is that evidence-based practice process. Like, and you think about EBP, all the research we have and the decisions we're making now are based on, in generalization, 15-year-old data, right? The sort of thing is 15 years to get evidence to practice, right? So we're making decisions based on 15-year-old data, potentially. And AI gives us a chance to make decisions on real-time data. And so it's a new paradigm, I think, for evidence. And I think we have to sort of take that in and think about that. That changes how we practice. And we've been taught so much about what's been known. Now it's generating insights that are in real time. And we haven't been trained to do that.
How to incorporate
that.
Yeah, that's a really good point.
And I think, the example I heard of, and I think it's still relevant for AI too. It's like, on the unit, you can ask a friend, you can look something up, or you can use your best judgment, right? And I think about Who Wants to Be a Millionaire, right? The show, right? The worst, if you didn't know an answer, the worst thing you could do was phone a friend. That was the worst choice you can make. It was statistically the worst, most inaccurate thing. But what do we do as nurses? We phone a friend most of the time, right? We call up our buddy on the nurse's station. We walk over, hey, what would you do, right? Statistically, that's the worst way to attack a problem you don't know. The best way was poll the audience, right? Because now you have a group of knowledge with different backgrounds that are voting, and generally that was more correct. And I think about AI, it's like the next layer of that. Now you're polling the audience with almost unlimited data, and you can get insights. Now you still have to make a judgment call, right? Does that sound reasonable or not? And but I think that's sort of a way to think about it. We phone a friend and we don't have any idea. Now we can ask the internet or ask a defined data set. It's not always the internet. If it's a closed data set where, it's our hospital data or EMR data, we can, it could have better answers for us and actually enhance what we're doing.
Yeah.
So I'm thinking about this now. So you're involved with Veritas, right? Yeah. So Veritas has now launched Ruby, right? A community, a social network enhanced for nurses.
Yes.
I mean, that could be the ultimate poll the audience, right? A safe clinical space for for nurses to go ask relevant clinical questions and get professionals, not influencers, not TikTok, not the person in their kitchen recording a video about how awesome their, MI algorithm is, like literally professionals. You could poll the audience on clinical questions and potentially layer an AI element to that and actually get more relevant nursing. I mean, you could potentially harness the entire nursing profession's knowledge in a single space, put AI, technology on top of that, and ask clinical questions. I mean, that could be super powerful.
Yeah. Yeah. The way that I think the opportunities we've talked about the ways in which we can enhance that patient provider, that patient nurse interaction. But the hope of how we can enhance our profession and kind of recreate some of that community and collaboration
Like a virtual nurse station almost, right?
Yeah, exactly. Yeah, and you could tap into that. Mm-hmm. Yeah. I'm really excited about what we're doing with Ruby and creating that kind of that community for sure, and the opportunity to look into some of that and really start to understand as a profession how our roles evolving. What are those skills and those tasks and the things that we do that really make up our role? Mm-hmm. And then I think to start looking at, where are those opportunities to automate or to apply AI as well? I think there's a lot of opportunity for us to really kind of level up the profession, like you said, it's our blockbuster moment.
Yeah, it is.
And what we do, is not the tools aren't just reflective of the data, but reflective of our values as well.
Right.
And so how do we start to really understand those? And, if I even kind of go deep on a philosophical point for a moment is, I've been encouraged by how our conversations around AI and the questions we're asking. I'm starting to hear a lot more philosophical questions about, what does it mean to be human?
Yeah.
Right. And because for us to try to understand what's a human task versus what's a machine, where should we apply machines? Where do we need the humans? Yeah. And we're at, I think it's getting us to a point where we're starting to ask some really good questions. Yeah. With how we're thinking about AI.
I think we have to sort of start questioning the future of our practice as well, right? So that we can move into sort of where are we going with this stuff? Nursing school has been built on memorization and defined pathways. Mm-hmm. And we create really good generalists that know how to pass the NCLEX. Mm-hmm. But, in my role now, my team runs the new graduate program. We brought in over 800 new grads last year. I still have to put them through a year worth of transition to practice programs in order for them to be safe, independent practitioners. I think we have to fundamentally question, is nursing school set up the right way? Mm-hmm. With the future of clinical reference technology, with machine tools, with critical thinking enhancements like the AI tools that we talked about, what do we need to change from an education standpoint to prepare nurses differently so that they can work in a world like that? Yeah. Because nursing school is not doing it, in my opinion.
Yeah. Yeah, maybe that's one thing we can do. Actually, what would be interesting is to follow with the audience. So maybe what we'll do is in the show notes, let's create a survey. Yeah. Because I would love to be able to hear from listeners and see how prepared do you feel like you are, or where do you feel like some of the risks or your concerns are with AI? And and how do you see it influencing your practice? And just what's your exposure? Are you using it today at all? Because I have found that nurses, as I've been traveling and speaking, really only about 30% have really knowingly used any form of generative AI. Yeah. I think that's starting to shift. But I think it would be great to kind of to hear back from listeners to see, where are they at with this? And how is that shifting, and how do we need to be thinking about education differently? Because educators are wrestling with this as well. Yeah. That's where this all of a sudden hit and caught fire, is kind of in the educational space. Yeah. When they release these tools.
Right. And writing those papers and care plans, you can now type it in and make it do it for you. Right. So what's the next layer? If that's table stakes now, what's the next layer of human thinking? It can, we're going to have to do more. We're going to have to go deeper. We're going to have to use that human element of creativity and connection. That's really what nursing is good at, right? I think generally the profession's spirit animal is MacGyver, right? We got to figure stuff out with chewing gum and a paper clip, and we got to make care happen regardless of what's happening around us. And I think the tools that we talked about today can that's all that knowledge and memorization and referencing, and we have to go now above and beyond. So our profession has to evolve, I think. So. One thing I'm curious, Rich, as we sort of wrap up is, what is your vision for the future? And with all you know about these tools, paint a picture of where nursing could be. Mm.
Yeah, I'll ask this of audiences very frequently to try to see where we're at on this. And it's so easy. As humans, we are enamored with the complexity with the complex. And our natural tendency is to make things more complex than to simplify. Yeah. And so what I'm trying to really cast that vision for is a version or a future of healthcare that is simplified. Mm-hmm. And that's what gives me hope with AI is that there's enough of an opportunity to automate things to help us get back to really kind of that essence of nursing, of caring for another person when they're in the most vulnerable state.
Yeah.
And where technology kind of disappears into the background.
Yeah.
And so, if we can do the voice capture for documentation and have that parsed in the medical record for those who need that information, and we can recall that information at a moment's notice and be able to reference that like we've talked about, that gives me a lot of excitement for where we could go as a future, because I don't just care about the patient experience. I've always said the best way to address the patient experience is making sure we have a good clinician experience, a good nurse experience. And so, again, AI through these types of uses, I think, will have the potential to get us there.
Yeah. As
long as we make sure that we're at the table and we're conversant enough in these technologies. We know how to show up in conversation and help make sure that they're being deployed for the right reasons. And we're guarding patient safety. We're guarding some of these things. We're ensuring there's transparency.
And because we're the most trusted profession, we need to maintain that, and we have the ability to make sure that these tools are used for patient good.
Yeah. Well, I'll flip the question back on you.
I've been saying this for years, and I think it still rings true because we haven't got there yet. I think there's three things that I see happening now even faster with these tools, right? The first one is everyday life is now the new context of care. So people, no matter where they are, can be impacted by care delivery, whether that's a choice in the grocery store to buy the cookies or the sugar-free cookies, like that's now possible, even with computer vision. Which thing based on my clinical diagnoses, which thing do I buy and how does it impact me, right? I think integrated care teams linked to people, not places, and we're seeing more of that, right? Telehealth, the ability to have ask a nurse questions and sort of those responses and things. And I think the last piece is personalized health experiences enabled with technology. Instead of throwing everyone on a med-surg unit and say, we're just going to go through the MI protocol with these people, we can hyper-personalize this stuff because now we have tools that in the moment can customize care. And not generalize those 10 studies that were done 15 years ago, but like ask it based on those 10 studies and the clinical context I have now. How do I make a different decision and personalize this for the guy in front of me or the person in front of me? And I think that's the superpower. And then just going back to what we started with, right? If 86% of our time is documenting and finding stuff, imagine getting 10 hours back in your shift to do patient care, to have a break, to go to the bathroom, to have a conversation, to do scholarly work, to participate in shared governance, all the things we need as a profession, and not just be running around trying to find where the nearest pump is and to find that one person who has that one piece of information that you need and you have to page them. We still use pagers, I think only drug dealers and like burner phones are using pagers maybe, but healthcare is it, and fax machines. We can do that in real time now. We can give time back to clinicians to do the work that nurses do, which is care for people and keep them safe and advocate for them and not just live their life in a computer. So I think there's a huge opportunity here. And like you said, nurses have to be at the table. And when we go and protest it or say we're never going to adopt this stuff, it's already happened. It's that ship has sailed. We don't have to like it, but we need to be at the table to direct it. And if we're not, then we could become irrelevant that's why it's our blockbuster moment. If we keep going back to, I want to chart my ICU data on a piece of paper and fax it in, the world's going to pass us by and other professions are going to come in and fill in that gap because they're going to adopt. And so you don't have to blindly adopt it. We need to advocate for it and be engaged with policy. But we have to start thinking about what is the future of nursing, or we could become irrelevant.
Instead of writing those signs like trust nurses, not AI. We need to be on the forefront of those conversations and saying this is how we see AI helping us be better nurses.
And trust nurses, not AI. Exactly. I mean that's 100% true. But doing that isn't eliminating AI from the equation. It's creating tools that actually work for us and our patients, and not just saying it's not going to work.
Well, awesome. Well, I hope everyone listening and tuning in has picked up a thing or two. It's been a great conversation, and I know we're just getting started. When we talk about the hyper-personalization in particular, it makes me think of, again, some of the work that my team's doing around Lazarus, the Lazarus agent, and just trying to make that recruiting experience less painful
Yeah.
and more
Imagine
personal.
you got matched to jobs more intimately and found the career passion you wanted.
Right, exactly. So I think there's so many opportunities, and we're just getting started with the ways that we can utilize some of these technologies. So I think the biggest word of advice is lean into it, and don't blindly accept, but don't blindly discard it either.
Yeah.
And so you've got great resources available to you. You've got Dan and I. Probably the best way to connect with us is on LinkedIn.
Yep.
And both that's actually how we first met was through LinkedIn. And so
yesterday was the first time I met Rich in person.
Yeah. And so, how we think about building community amongst nurses, both of us are passionate about helping other nurses succeed and kind of find your calling in your career. So we want you to be successful as well. So you can reach out to us on LinkedIn, start engaging on Ruby on the platform we just launched as well. And then, Nurse.org is a great resource, pushing out a lot of really great content, and expect to see more around the topic of AI as well.
Yeah. Join us on LinkedIn. We have tons of resources, and put in the comments too. Rich and I have been thinking about what do nurses need around this topic that we can provide education resources. Throw those in and let us know, because we'd love to create that for you. And both of us have give talks all over the country. Join those in and read our books, that kind of stuff. Because it's just getting started, and there's a lot of opportunity here. So thanks for joining us, and we hope this was valuable. And let us know in the show in the comments. We'd love to hear what you think and what we missed and where we can go next.
Awesome. All right. Thank you all.